Okay. I want to call the meeting of the Hopkinton Town Council of June 17th, 2013 to order with a moment of silent meditation and salute to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. First on the agenda tonight is I'm happy to introduce our Lieutenant Governor for the state of Rhode Island, Lieutenant Governor Elizabeth Roberts. She's going to talk to us about the Affordable Care Act that is soon to be implemented. I believe the open enrollment is October 1st of this year, and then the act, I think, takes place January 1st of 2014. Also in the audiences, I invited Mike Lickenstein from the Wood River Health Center, and he's also got a medical doctor with him tonight, this man Love. And I guess without further ado, Lieutenant Governor, please.
Yes, thank you.
Yes, thank you.
I'm mindful, is this the best place for me to stand? How would you like? Great. Well, let me just begin by thanking you for the invitation. People are thanking me for coming. I'm delighted for the invitation. And I, at this point, go as many places as I'm invited to answer questions, share what we're doing, and hopefully get people a little more knowledgeable. So I want to spend a few minutes talking, but really would like to answer questions as well. I will tell you that I could talk for 2 hours, so I'm going to do my best not to do that. But I encourage you either to stop if there's a question you have. I don't know how you want to manage the dialogue in the room, but I'm very happy to take questions both from the council members or from the public. And the other thing I would encourage you is if I use language, I do my best not to use jargon and acronyms, but if I do, please catch me and say, can you explain what that means? Because one of the challenges in healthcare, as in some of the areas like emergency management that I work in, is it's laden with acronyms and other language that most of us normal people don't use.
Yeah.
So I really want to thank you.
What we probably want to do is maybe have you give your presentation and then save the questions
Perfect.
For the end. Just so
Perfect.
If anyone has a question, just please write it down, because she'll go on a lot of different topics that I'm sure will complicate us and make things more.
Anyway, but once again, thank you for the invitation. A few points I want to make before I get into some of the details. We can call it Obamacare, the Affordable Care Act, same law, passed now 3 years ago. It is here to stay, certainly until the Supreme Court ruled a year ago. There was a lot of discussion. As you know, it was upheld. When President Obama was reelected, then that also took some of the political momentum from those who were opposed to the law away. But one of my goals, and it has been a goal for us in Rhode Island, is to kind of depoliticize this topic, talk about what the law does, what its possibilities are for us here in Rhode Island, and answer questions. We do not all agree, and it's really, actually, we're finding, because we do have a lot of public meetings, that sharing differences of opinion has actually been really valuable. We are probably going to be one of the more successful states in the country in working with small business, for example, in this law, because they have been part of this process with questions, with concerns, with great ideas, and it has been integrated into what we're doing. It is, to do a small civics lesson, as I saw Stephen Hopkins' monument outside, this is a great example of federalism in our country. It is not, in fact, the federal government telling us what to do. It is the federal government setting some laws and rules about insurance, but then turning to the states and saying to them, if they choose, for many parts of this law, please implement this law. When you talk about the Affordable Care Act being implemented, the portion that people are talking about is the development of the badly named exchange. It will get a Rhode Island name, hopefully in the next week or so. And I'm going to talk about that, but there are actually some parts of this law that are already in place, and I want to talk about those first, because I think it's important that people realize some of the things that are already going on. Also important to realize one of the biggest motivators for this law is that throughout the country there are close to 50 million people without insurance. In Rhode Island, there are about 120,000 people without insurance. There, 3/4 of them traditionally are people who are working, but they're working multiple part-time jobs or for small employers who have largely been priced out of the market. So the goal of the law is to expand coverage to insurance. And for those who have been watching Massachusetts, it's very much modeled on the law that was passed there 6 years ago. Focused on expansion of coverage, not focused on some really important issues like managing cost, which we are also focused on, but it's really focused on getting people covered so they have access to care. Because also it's hard to change the system when there's a big group that can't use it properly because they don't have access to physicians, but have access to emergency rooms in our setting and to overburdened, actually, neighborhood health centers. So some things that are already the law that have happened since this law was passed 3 years ago. Some are not as visible in Rhode Island, but you hear about them on the national news. The fact that children who have had serious illness who could not actually get insurance in many parts of the country were required by the federal government to be allowed to get insurance in whatever state they lived in. Didn't impact Rhode Island because that was already our state law. Something else that's really important to note is that insurance, just like physicians and other providers, are licensed by the state, not by the federal government. So states have had laws that vary from state to state. We will still have those laws. We just have some overriding laws that the federal government sets, but many are still going to be set at the state level. So no more pre-existing condition exclusion for children. There were some Medicare changes, and actually this was one of the most political parts of the conversation, and I actually went out with Catherine Taylor, who is our head of elderly affairs for the governor, to senior centers in the fall, because I actually thought on both sides, Republicans and Democrats, there was a lot of political conversation about Medicare that wasn't entirely accurate all the time. There have been some expansions in Medicare coverage because this law passed. So preventive services are covered, which were not covered under Medicare traditionally. And the donut hole, which is the way Medicare Part D, and for those who are older who have the prescription drug coverage, you may not have fallen into the donut hole, but it was designed so if you were covered for a certain amount of drug cost, then there was no coverage for a certain amount of time, which was sort of counterintuitive. If you think about people who need that level of drug coverage, you wouldn't think there would be a gap, but it was designed that way to meet federal budget targets. And then your coverage resumed. It was called the donut hole. That is being closed. It was closed the first year with a check to seniors who fell into it for $250, and then it is being closed 10% a year so that it progresses over time. The first year in Rhode Island, that was $8 million back in seniors' pockets. So a significant change. There are also changes in Medicare which are talked about in terms of taking money out of Medicare to pay for the Affordable Care Act. Those changes are not the changes that you see personally as much as they are changes in how hospitals and doctors, but particularly hospitals, are being asked to do their work. So for example, a major change that has happened in Medicare is that now if you are readmitted for a diagnosis related to what you were just discharged for, the hospitals will be penalized for that, for example. So there are things that are aiming to improve health care, not pay for care that isn't the highest quality care. Definitely controversial, but it's really important that people realize it's not that benefits are being taken away, it's that they're looking at changing how care is delivered. The biggest change I noticed in my family is that my 24-year-old working daughter was put back on my family coverage. The highest percentage uninsured in the country are young adults under 30, mostly because they tend not to have poor health problems, but also because, as we know with our children of that age, they think nothing bad can happen to them yet. I have to say as a parent, it's a very low-cost way to insure people, to put them back on family coverage where they were already. I appreciate that protection when there's a catastrophe or something serious happens, but also for those who have some kind of health problem that can develop over time, it's a great advantage that they're able to use healthcare in the most appropriate way, which is in a doctor's office rather than in an urgent care or other setting. So that is, I think, at this point, close to 8 million or 7 million, I've lost track of the number, 7.5 million young adults in the country are now back on their parents' coverage. There's also been a small business tax credit in place, which is a bridge program. It's a 35% tax credit for small businesses that provide insurance to their employees. They need to be small businesses with an average wage for their employees of $50,000 or less. So intended for the kind of business that we have in Rhode Island, smaller manufacturers, service businesses. No offense to the attorneys in the room, not intended for a law practice, for example. It's intended for people who've been priced out of the market. That 35% tax credit after January 1 will become a 50% tax credit for those businesses that choose to purchase on the exchange. So let's talk about the exchange for a minute. It is one of the hot topics. It will get, as I said, a name that is better than the exchange. It is an online healthcare marketplace, and the goal is that it is going to look to you like the other ones that you use, like a Travelocity, where you're comparing and making choices. The back end of it, which we hope you will never have to pay attention to, is far more complicated than it is when you're purchasing a plane ticket, because it needs to decide, because you are going to be able to look at insurance options, and if you're income eligible, you will have subsidies to purchase insurance, which is one of the biggest things that keep people out of insurance, small businesses or individuals, is the cost of coverage. So there will be subsidies in this program that go up to 400% of poverty. The legislature is going to let us know tomorrow whether that's from 138% of poverty or from 175% of poverty, as they recommend. So those individuals will be eligible for a subsidy. It will be a sliding subsidy. So if you're low income, if you're near the bottom of that income, you will have a big subsidy. If you're near the top, you'll have a small subsidy. But you will access those subsidies through this online marketplace. So you'll not only pick what makes sense to you, but then you will see if you're eligible for a subsidy and you will receive access to it. I call it a subsidy. It is technically a point of purchase premium tax credit, but I find that a much more confusing piece of terminology to use. That is paid for with federal tax dollars. There are no state tax dollars involved in the subsidy. There's also, that's one major way we're going to cover more people. We in Rhode Island are choosing to expand Medicaid coverage. And the biggest difference there, and this is something I saw campaigning particularly locally when I would be at people's doors, were people who were not eligible for Medicare because they were not old enough and not disabled, didn't have access to insurance that was affordable to them because they were very low income. I would frequently find they were people who were older, not able to work because of health issues, but not eligible for disability. I met many of them. So Medicaid eligibility, right now, if you're an adult in Rhode Island and you have children who are dependent and you're low income, you can qualify in our state for Medicaid up to 175% of poverty. And I should have all those numbers in my brain, but it depends on family size. This law, if a state chooses to implement, makes eligible adults without dependent children who are low income for Medicaid. So Medicaid to me is one of the more confusing programs because a lot of our seniors are on it for nursing home services and other kinds of long-term care. Disabled adults, so our developmentally disabled Rhode Islanders, as well as people with serious physical disability. But low-income adults who didn't have children were not eligible. So that is a category of people who will become eligible. In many states, we are a state that is choosing to do that. It is 100% federally funded for the first 3 years, 90% federally, as Medicare is now, 90% federally funded after that. And Medicaid right now is basically a 50-50 match for the state, so it's a significantly enhanced match. So that exchange, the online marketplace, the goal of that is also to have small businesses have better options. There will be a portion of the exchange where a small business can purchase for all their employees, and they would be eligible for that tax credit I described if their workers are at that income level. But also, we are going to create an option in Rhode Island that the federal law made available, and I think we might be the only state doing it initially, where an employer can make the money for the insurance available to the employee to make their own choice on the exchange. It's going to be called employee choice option, something that the employer said they wanted and that their employees wanted. And so that will give some flexibility. If an employee chooses to purchase up or chooses to purchase less, the employer can say, here's what I can pay. And right now what employers are doing is doing that, but saying, I have to increase your deductible, or I have to change your emergency room copay, or your physician copay, or prescription drug coverage. This will give that choice to the employees, if the employer chooses to do that. So that enrollment, so that website is going to go live on October 1st. There will be web resources available before that for coverage that begins January 1. So whether you're a small business or a lower income individual or a working person who's a little bit higher but is priced out of insurance or has difficulty affording insurance, you will have access to that and the Medicaid expansion on January 1. It's a lot of technical information. The last thing I want to say, well, there are a couple of last things I want to say. One is that we are not ignoring the cost issues in healthcare. The law, the Affordable Care Act, Obamacare, did not pick a way that all of the American healthcare system should be changed to manage costs more effectively and focus on quality. They said, we are going to make funds available to states who competitively request them to try new approaches and see which ones are most effective, and then try and take those to scale in different places. We have 3 of those innovation grants right now in Rhode Island. One's an asthma collaborative out of Hasbro Children's Hospital. There's another one about neonatal intensive care and kind of preventing and managing that more effectively. And there's also one at University of Rhode Island for disabled adults and managing their healthcare needs that are their primary healthcare needs more effectively. We also have a federal grant that is focused on really looking at our entire healthcare system and where we want it to go with a focus on cost and quality. We are going to need to take that challenge on head on. A lot is also going on in the private sector. Government is not going to solve all this problem. Blue Cross, our hospitals, our United Healthcare, a little bit less so, Neighborhood Health Plan, are all also involved in innovations. There's a very significant primary care, our family physician, the team-based approach called a medical home project, where Rhode Island is actually leading the country. And we are having great success in meeting people's needs more effectively at a lower cost and with higher patient satisfaction through that. And the health centers are a major piece of that, as well as a lot of the physician practices. So there's a great deal going on there as well. We do all of this in public gatherings and public meetings, and it is a long way from here, unfortunately, where we have most of them. They're usually in Cranston or Providence. But people are welcome to participate. We have a handout that has frequently asked questions, particularly focused on small business, to leave here today. I hope we brought enough for everyone here. But also on that is the website that the state has created, where you can follow the work we're doing, see when the meetings are being held, look at minutes and notes from the meetings. You are welcome to participate for one meeting or multiple meetings. So if you see a topic coming up that you feel is particularly important, you can come. It isn't that there's a particular group that is appointed, it's that we open the doors, and we have had great success with that because people are volunteering their perspectives, their professional expertise, and I think one of the reasons we love to run ourselves down in Rhode Island, I think this is a place where we're doing quite well. And we have differences of opinion, but we have not been divided by politics, and I think that's been very helpful in the process as we've gone forward. So I'm going to stop there. That was a lot. As I said, there is a blending of state and federal authority here, but the implementation is going on at the local level. So we have points of access for people. I will also say to you, when the exchange opens, I will tell you right now, it will not be perfect. There will be little glitches in it, but also it will be largely reflective of our current insurance structure. But we are going to use that purchasing power, we are already using it, to push for innovation from our insurers, particularly in small business. You have usually almost no kind of bargaining ability with the insurers. People go back and forth between United and Blue Cross because they try and get a better price. This will offer options to small business, more options to individuals, although not as many more as we had hoped initially. The first year will be our get the bugs out and improve the system, and Tufts, which is currently in our market, will not be on our exchange until after the first year. So it will continue to improve, and we welcome comments and suggestions after January 1, because we will be working to improve it, and we will have staff there to respond and work towards improving it. So we recognize it won't be perfect from the beginning, but our goal is really to serve the needs of, we thought the federal government was not going to be able to push for the focus on what we see as needed in Rhode Island and innovation in our insurance market. So we made a choice to do it here. So we should take advantage of the opportunity that gives us to influence it directly.
Yeah, thank you, Lieutenant Governor. I think what we'll do now is anyone in the audience that may have questions, because I know the councilors always have questions, you know, take those folks first and have at it with Lieutenant Governor, one at a time, please. And does anyone have any questions specifically for the Affordable Care Act? Yes, okay. Harvey, can you maybe come up to the mic, please?
I wasn't planning to ask a question, but as people become eligible for Medicare, what I wasn't quite sure how that fits in. Are they still into this program?
So actually,
are they going to be making choices?
I'm so glad you asked me that, because one of the points I didn't make very well, 2 points I didn't. One is that for those of us, which is a lot of Rhode Islanders who are currently on insurance with our employers, there will not be much of a change. There will be a few, particularly in other parts of the country, where some of the benefits have been less comprehensive than we see here and then the federal government expects. If you're on Medicare, this does not change your Medicare. It changes the coverage, as I described a little earlier on. So people now have preventive services. Medicare was designed in the 60s when our healthcare needs were actually somewhat different than they are now. Now we're really, our community's healthcare needs are largely chronic, more focused on chronic illness than they are on heart attacks and, you know, kind of more immediate. As I like to say, when I was a kid, cancer was almost always a terminal diagnosis. Now, for a lot of people, I know it's a chronic disease that's managed. So Medicare has recognized that. Your Medicare choices will stay the same. You will still have United and Blue Cross as your possibilities, or your traditional fee-for-service Medicare. So this law does not change your options on that front.
Thank you. Anyone else out in the audience? Questions for the Lieutenant Governor? None? Okay, that's easy.
Can I continue from Harvey?
Yeah, go ahead, Barb.
I just want to continue on Harvey's question. Medicare isn't changing, so Medicare stays the same, but what about all of the Medicare programs, the addendums that you have to do to Medicare to make Medicare work more effectively for your family? Does that...
So you mean like a Plan 65?
I don't know what they are yet. I'm not on Medicare yet, but I do know that you can get Medicare, but then you need secondary policies.
Right.
Part D or whatever.
Part D.
Well, so Part D is the
Gap
prescription,
insurance.
right. So there's A and B, which is hospital and physician coverage, which is, oh God, I always forget. A is the one you have to take no matter what. B is, so my husband's eligible. He had to take A, even though he's covered under my policy, he didn't have to take B. So that's your, it's like your Blue Cross and Blue Shield, A and B.
Right.
D is your prescription drug coverage, and there are actually 40 options in Rhode Island. And I urge you, it's actually more options than we probably should have, but I urge you, and to have your constituents, most senior centers in the state have senior health insurance advisors who work there, who are trained, and you can make an appointment and go and talk through your particular issues. You do not need that supplemental Plan 65, and United has a similar one, and I've forgotten the name. There's also, I always forget my terminology, what are they called, managed care Medicare programs? Medicare Advantage. Medicare Advantage. There are Medicare Advantage plans. It's Blue Chip for Blue Cross, and United Health. Yeah, they have one as well with another name. For those, that is a managed care, so you usually have a more limited network, but you do not need to buy a supplemental. So I really encourage people to take advantage of those senior health insurance counselors because they can help you make the decision about what's best.
Our issue in Hopkinton is we don't have a senior center that would have that person. However, we do have Wood River Health,
Right.
who I believe is going to be the point person in this case. And this is David.
That's Michael.
No, David's over there.
Oh, I'm sorry.
So,
Yeah. Can you explain how you're going to work with the community and the elderly on this program?
and so can I also, before you say something, say that you do not have to be a resident of the community where you go to, you talk to the health insurance counselor, because the state supports them. So if people choose to go to Westerly, that is available to them. Did you want to answer?
Yeah.
Thank you. Michael Lichtenstein from Wood River Health Services. So yeah, you're absolutely right. The health centers across the state have received or will be receiving funding to hire outreach and enrollment specialists. So these are staff that will be specially trained to learn about and understand the whatever we're going to call this new marketplace, this exchange. I mean, it's complicated. How many of you have mastered what the Lieutenant Governor said this evening? There's a lot of information, and we know that, and the state knows that, and the federal government knows that. So they've figured out a strategy to put people on the street, so to speak, that will have training. In fact, there's a federal set of standards that will be passed down to the state that the staff that we hire to do this outreach and enrollment work will actually have to be quote-unquote certified. So there'll be people who go through a 25 to 30-hour training program plus ongoing kind of support and mentoring to be able to help people not only with the internet-based approach, but also to come out to the community.
One-on-one.
One-on-one. We're happy when we have staff on board to come here, to do workshops, to go to the senior centers, to go to any community location, the library. We'll also have opening and opportunities at the health center for people to come up to get some basic information. And there'll be people available basically whenever the health center is open to help move people in the right directions. Because we know it's confusing and we won't have all the kinks worked out either initially, but together we'll figure out a strategy to get people the information that they need and or who else that we should be involving to help sort that out for them.
Because I am concerned, we have our elderly in town, but we also have the low income, and I know that a lot of them are funneled through Wood River Health. And so that if you have something there, they'll be able to access it, and you'll be able to offer it. So even if they don't know they need to access it, they'll now know they need to access it.
And in fact, if someone is visiting a family member in another part of the state, I mean, these are going to be outreach and enrollment specialists that are available across the state.
Right.
So it may be that you're visiting your son or daughter and they say, well, we know at the local health center or at the community center they're having a workshop this afternoon, let's go down there. The information will be the same across the state in terms of what's available and how to access those sites and get the right decision made for you and your family.
So, and I'm going to leap in on top, because one of the things I sort of skipped over is about how we're trying to make this an easy process, but it is complicated and it's different than buying shoes online. So there will be many levels. There will be the online kind of FAQ, there will be an online chat, there will be a phone and in-person. And the in-person, exactly right, we're trying to find people where they are. So there will be places where people can come to, like in a public library or senior center, community center, but also they will be where people seek care, because that's where people will go, and it's also where people trust. I mean, people trust their doctor's office. So we really are going to do our best to make this something that responds, and the places in Hopkinton are different than the places in Cranston where I live. And the local community knows those places better than the state does. So we're working directly with local organizations to get that word out. You will see a big increase, I would say starting in mid-July, in terms of PR, and then very much in terms of people. Are they starting you September?
Well, we're not sure yet.
Not sure yet.
We haven't
So
received the-
because you can't sign up until October, I think there's a hesitance to put people where they say, well, come back and see us in 30 days. So you'll really see a big increase in on-the-ground people at on the physician and hospital and other sides after October 1.
Thank you.
I'm sorry,
Yes,
I interrupted
yes,
you,
ma'am.
ma'am.
Question. My name is Julie Thompson, and I'm ignorant of insurance, but I'm very passionate about alternate health care. Are there provisions equally for allopathic and alternative care in this program?
So I would say to start with, this is going to more reflect traditional insurance in our state. One of the interesting things about this online marketplace is it opens up, I jokingly, I've worked in this area a long time, I say, this is the biggest purchase that most people make. They have no idea what's in it until they need it. It's like buying a car every year and you don't even really know what's covered until you walk in a doctor's office. So I'll be honest with you and say not significantly different than right now. But one of the biggest things I think you're going to see is consumers are going to have more ability and a place to comment and say, this is what I want. I think you're going to see plans that have a bigger focus on primary care and maybe a limited network of hospitals, for example. And there you may see more alternative approaches because that may be what those consumers are looking for. So I think you're going to see more, there's going to be more direct competition for your business than there had, and more open competition. And I think that's going to change some of the health insurance market. But always a struggle. I hear you. Always a struggle.
And I object to the word competition. We want to complement, we want to educate.
Oh, so I meant competition among insurers. I didn't mean competition with different types of care. I appreciate that.
Thank you. Anyone out in the public again wishing to make some comments or questions? Yes, ma'am. Come up to the podium, please. Oh, the mic.
Hi.
I just had a question about the tax forms. They say you should have your tax form before you go online and buy anything. And should you get your tax form that you had last year that tells your income and all that, or how does that work?
So this is where I'm going to not be as well informed maybe as some of my partners, because I cannot tell you the exact process that's going to be in place. Have they informed you of that? So I'm going to suggest that you wait a month or two until somebody is really clear on exactly what you're going to need. I don't want to send you scrambling for things you may not end up needing. Because I think they are going to do a lot of that with the connection inside government, rather than you having to enter all that data. So wait and see how that's going to work.
Thank you. Scott, you have any questions?
I got
for
over a
Lieutenant?
dozen things.
Oh dear, just start with one.
Yeah.
Okay. One of the concerns, can you describe the so-called penalties people will have if they don't buy insurance? Because I think that's a concern.
So I know most of them. I will try and remember. So if you're an employer with fewer than 50 employees, there are no penalties. If you are a large employer and you do not provide insurance, so it very much mirrors what happens in Massachusetts. You pay a fine, which is well below the cost of insuring people. So some have said, therefore, employers will ignore it, which has not been the case in Massachusetts, actually, but that you pay to the government with the intent of paying for the cost of services for people who you are not insuring, who will need to have services provided for them. For individuals, that is an escalating penalty if you do not have coverage, if you have affordable coverage available to you. And that's a very important if, because there will be a gap of people. We want to minimize that gap, but people who are lower income but not eligible for subsidies, or for a number of reasons, they will not be subject to an IRS penalty, but if they have affordable insurance available, they will. I cannot tell you the exact numbers, but I actually think if you go on the web, you can find those exact numbers out. I don't have them, just like I don't have the numbers for 150% of poverty in my brain either.
Because I think what happens usually is that when people look at their own personal budgets and they have to pay for housing and food and things like that, insurance by nature has to be below that because everybody has to eat and they have to
Right.
usually maintain a car to get to work, et cetera.
But I do think that's why the subsidy is so important, because the goal of the subsidy is to make it much less of a burden on families. And I think most families want to have health insurance. It's the second leading reason that people encounter personal bankruptcy in our country, is that they become ill. So the goal here is to protect people, and providing the subsidy is the effort to try and not make it such a financial burden.
One of the concerns that I have is that if you look at healthcare in the southwest corner of Rhode Island, other than private physicians, dentists, et cetera, we have the Wood River Health Services and we have the Westerly Hospital. And of course, the Westerly Hospital has gone through a lot of changes. Those are the two biggest. And my biggest concern is to what extent have hospitals in Rhode Island or nonprofit health care centers like Wood River, their financial stability, because I believe that at least, I can't say I'm an expert on Wood River, but it's been widely reported that Wesley Hospital had a lot of financial issues. How does this impact the financial stability of our health institutions?
So our hospitals, actually well before this law came into place, were facing some financial struggles, because how long we stay in hospitals has declined significantly. You saw it in Westerly, you see it in some other hospitals where the numbers of inpatients is down significantly. Related to the law, actually, I think for our health centers, they're going to see a lot of people who they have been caring for with little reimbursement, if any, will now have access to coverage. So I think it's going to be challenging more because so many people walk in the door with insurance cards than it is that they are going to be coming and seeking care without an ability to pay. If you talk to the hospitals and health centers over this economic downturn in Rhode Island, what they, and particularly in our hospital emergency rooms and our health centers, they have had huge increases in the numbers of people who need care and who they ethically and by law are required to care for, who have no ability to pay. So this will help them significantly. What is happening in our hospital system and how we deliver care is also changing and will change, and our challenge is to make sure that we are meeting the needs of the community and the healthcare needs, the health needs of the community as those changes happen. But those are less related actually to this law than they are to changes in how we deliver care.
I asked that question knowing that that's probably correct, but it's so important to this region. And we're
Absolutely.
talking about healthcare, and obviously if people do go to one of those facilities, insurance, I know that the Wood River Health Service uses a sliding scale. Excuse me, and the Wood River Health Service is more than just a health facility also. They do social welfare type stuff and things of that nature. I do have a question. Does this, and I think I know the answer, but I want to be clear, how does this impact COBRA? If somebody's on COBRA now, does that have any impact on people that are on COBRA?
So I'm not an expert on, I'm sort of an expert on COBRA before the law. I'm not a total expert. I believe COBRA is still available to you. I think there will be some people, because COBRA is a very high-cost option, there is now another option for people who have lost their employment. I think you will find most of them will choose to go onto the exchange to purchase coverage because they will be able to stay with probably the same insurer they're with now and purchase health insurance. So I think COBRA will still be available, but I think it will be used less frequently because there will be other more affordable options for families.
How about deductibles? That's always interesting. Like people get insurance and they have to pay up to a certain amount. How is the deductible situation addressed?
So when you go online on the health insurance marketplace, it will show you exactly. So if you want to see an example of, it's not going to look the same, but what happens, go on the Massachusetts Health Connector, Google it. It shows what your deductible is, what your copay is for an emergency room, what your copay is for a specialist, what your pharmacy benefit is, and you can compare across insurers, and they do what's called metal tiering, and we will do the same. So platinum, gold, silver, bronze. They have different levels of deductible, different levels. So some people, like I, for example, might take a higher deductible and a lower copay for primary care and for basic health services, because I use those more. You will be able to look at those choices and make those choices, but it'll be right there on this computer screen. It's not hidden.
Another concern is, can you address the catastrophic health care situation if somebody has a real serious illness? And also, I think there's a feeling with some people, particularly our older populations, that some surgeries, they might not be able to get them paid for because of their age. Could you address those two issues?
So catastrophic health, one of the changes in the federal law, although this was mostly true in Rhode Island already, is there are no caps. So it's, if you get a serious illness, your coverage is not allowed to be terminated once you reach a certain level of coverage, just like they're not allowed to say they will not insure you because of a prior illness. And the question about not having access to...
Well, some people are concerned because of their age that they might not, I guess, have elective surgery or certain types of surgery because of the age of the patient.
So there's nothing in this law that has anything to do with that issue at all. Medicare, the changes they're making are much more around hospital practices and much less around patient choice and patient needs. So they're really focusing on how do we pay for the highest quality care. So not paying for readmissions, for example, really rewarding hospitals that provide the highest quality of care. They're not saying we are going to stop providing coverage for certain types of illness or certain types of situation.
I got one final question.
Yes, sir.
I was reading the material and maybe I understood it wrong. On the open insurance market right now, you can only buy Blue Cross?
So if you're an individual,
Yes.
only Blue Cross is available in Rhode Island right now.
Okay, so if somebody had United Healthcare and they had lost it for whatever reason, they'd have to, if they wanted to resume healthcare, they would.
So if they were on a group benefit with United Healthcare, you mean, through their employer? Because United does not sell to individuals in Rhode Island. and they will not be selling to individuals in Rhode Island yet on the exchange. We hope they will eventually. But Blue Cross will continue to sell, and I believe Neighborhood Health Plan will also be selling, yes, they're selling an individual and small business, both? Okay, we hope they will. And Tufts, we're anticipating the following year. They're in 3 different states in Rhode Island, and they informed us that they need to get, Massachusetts is their biggest market, that's their initial focus, and they will come to us the following year because they are not prepared to be in our market, and we're a much smaller market for them. So our goal is to have more choices for individuals and you'll definitely have more choices within Blue Cross than you have right now. So there will be different choices available to you than you have currently as an individual buying from Blue Cross.
I want to thank you for coming, and I know, and I appreciate the people that came to listen to you, because it's always important to have a crowd, and I guess I got my money's worth, at least with my questions. Thank you.
Good, thank you.
Thanks, Scott.
Thank you.
Sylvia?
We had been given some documents, I'm sure that were from your office, and one of them, the title at the top is Healthy Rhode Island. And under it, it says a plan to transform Rhode Island's healthcare system, and then it goes into explanations. One of the top items is for more information, contact healthyri. blah, blah, blah. But there's a telephone number, 222-2371. Now, if someone calls that number, do they actually get an individual, or do they get a machine?
It's my office.
That's your office.
Unless we are all on the phone, you get an individual. We have no phone pickup unless it's after 5 o'clock, before 8 o'clock, or if every one of us is on the phone, which doesn't usually happen. So yes, we have people who answer the phone.
Okay.
And that's my office. So remember I mentioned we're doing a kind of what do we want Rhode Island's healthcare system to be? The federal government has given us resources. My office requested it so that we could we don't kind of sit on any piece of healthcare turf particularly, and we can work outside and inside government both pretty effectively. The goal at the end of its very short time frame, we will be applying for a big grant from the government to really implement a piece of that, and that will not be run out of my office. So after that, it'll be a different phone number.
Yeah, so for now, if anyone has questions, that's the number to call, but at some point, it will change.
At some point.
At some
Yeah.
point.
So certainly but as long as I'm in office, that is a way that you can easily find your way into the health reform conversation inside state government. We frequently connect people to whether it's the healthcare marketplace, the exchange office, the Medicaid office, that they're all our partners, and we can help people find the right person to talk to if they've got an issue they want to raise.
Have you had to bring in more people?
Not on my office
Not
staff,
yet?
no.
Because people call you for many reasons, and
Right,
now you're
they
going to
do.
get calls for
They
this.
do, we do. So, but we have hired consultants to help us on the project because we don't want to increase the state payroll, and we're looking for people who might be smarter than we are about some things, which I always think is valuable. But no, I mean, our job is to manage that, and we have 2 people who, among the many other things, are first on the front line in the phones, so.
All right, yeah, because this is just the beginning of the conversation. And you have folks here tonight that are just beginning to, to get
Right.
into this conversation. And
So-
as it gets more and more complicated, they're really going to need contact information.
Right,
And we
right.
need people to answer the phone.
Right.
Thank you very much.
So we answer the phone. I would also encourage the use of email, but I will also say that certainly in terms of the whole signing up and the exchange and everything, the very best resources are actually going to be the ones that were described here, because they're people that you already know in your neighborhood, you already have a relationship with, and they're, particularly in a town like Hopkinton, that's going to be really helpful, because the needs are different, and people can answer a question more knowledgeably who's from this area for you.
Thank you.
Thank you, Sylvia. Yes, Bill?
For those people who are unemployed and under 65 years of age, will their health care coverage be fully covered by a subsidy?
It will not be, well, it depends on your income. So, and I'm not an expert on how far back, for example, if you lost your job last week or if you lost it 2 years ago, that'll be a very different. So if you're so low income that you're eligible for Medicaid, you have complete coverage, and that's up to 135% of poverty. Depending on your family size, that's at a different level, but it's pretty low. So if you're unemployed, no resources, you will have coverage under Medicaid.
Thank you.
in the new system.
Thanks. Yeah, Bob.
I have one on children. My husband and I have 5, and we were not able to get into that lovely loop where you could keep your family coverage for your children after college. So I have to say, I am very, very happy that that exists. I am sure every family in America is happy that exists. And now my understanding is they can keep the children on to 27, or is it 28?
I think it's 26.
Okay,
Yeah.
so the question though is, there are children in a family that may not be able to be, they may be employed, most likely they would be unemployed. I was thinking of children that are unemployed who may have mental health issues like depression, that may stay with their family, live with their family longer than the age of 26. Is there something that the healthcare program is going to work on mental health issues where a child stays in a family? The family may have coverage, may have family coverage. Is there any way to keep that child on the family coverage since they are at home and they have other issues?
So if you are disabled, so there
But
is...
you're not labeled as disabled.
Right, so then I think
You
the
know,
answer to your question is going to be no.
Exactly, that's my problem.
But one of the things we hope is that in the new system, you will be able to buy coverage that is almost identical, or actually may meet your needs a little better than the family coverage may, if you have, for example, unique healthcare needs, and we might have one of the plans which is better suited to an integrated, so some of our health centers, for example, do a great job and do a better job than a lot of our private system trying to integrate mental health and
Yeah,
physical health
because the
systems.
concern will be children that stay in a family,
Yep, I understand.
do not work, the family has full health care, but then the child can't be on it.
Right, so they'll be
Or
eligible.
the young adult can't be on it.
Right.
So that will be something that perhaps will, and then basically they have to buy their child their own health care. And it might be through a Wood River, or is that what you're saying?
Well, it'll be through one of the insurers, so it'll be through Neighborhood Health Plan or Blue Cross in that situation.
But then the family is paying for its own health care, plus then buying it for its...
Well, it depends. If the child is not working, then that child's eligible for Medicaid, so there's no
Okay.
expense. So, yeah, I think in many of these situations, and some of those situations, there's been no option until
Yeah,
now.
right.
If you weren't formally determined as disabled by the federal government, you were not eligible. Now you will be eligible based on income, and that there are a significant number of people who will have access to needed services because of
I think that's
that.
one of my major concerns, is how they're going to be addressing the mental health issues that we've
Right.
certainly been discussing over the last 6 months in the paper and
Yeah.
television and news and everything else.
So I will say that this is an area where I think we need enhanced community leadership, and if you know families who want to be involved, there's a big challenge, and we are making some progress in effectively meeting the needs and integrating primary care and behavioral health, mental health, substance abuse. We haven't solved that completely, and it's a real burden on families, burden on the community, burden on the individuals. So it's almost related to, but separate from Obamacare implementation, is how do we solve that problem? Because it's a huge burden for everybody involved. So.
It's a huge part of health that's not under
Right,
physical.
right. But now that there's coverage, there will be resources. So until now, you had to, as a provider, you had to cobble together federal grant money, some people who had some level of insurance, but you didn't have people walk in. Frequently, they had no coverage. Now they will have coverage. Our challenge is to meet their needs perhaps better than we've been able to do in the past.
Thank you very much.
Thank you, Bob. David?
Yeah, thank you for coming tonight.
You're welcome.
A couple of questions. Could you expand just a little further on COBRA? And the reason why I asked that is because I went on COBRA. I left work early, retired early, and was on COBRA for 18 months.
Right.
And it worked out fine. Would this plan eliminate COBRA?
So I'm not fully knowledgeable, but I don't believe it does.
COBRA,
So- right.
You know the premise behind COBRA? Is it-
Oh, yes, it keeps you on your employer-based coverage for up to 18 months if you
18
pay out of pocket
That's correct.
at the employer premium rate.
Would this plan supplement that program, or would it replace the program?
It would be an alternative to that program.
Would it be cheaper?
I believe it will be cheaper for a lot of people.
Okay.
But I think you will have the option of a person in that situation to make that comparison.
Right.
So you can go on the exchange. So lots of people can go on the marketplace. They can look for a lot of different reasons, to look at what the options are and what's affordable for them. But if you've got COBRA and you've got family coverage and it's $17,000, for example, you can go on and look and see, can I find family coverage that meets my needs for less than that? Less than my employer was paying? Maybe not, maybe yes. So it'll be an option for you. I do not believe this takes away
Am I
COBRA.
correct to understand it also might be, once a person retires, and quite a few people go on COBRA between the time they retire or they lose their job or whatever, and they're eligible for Medicare. At that point, people's incomes drop more
Right,
often
right.
than not. And as a result, it may come under a subsidized program
Correct.
to a certain extent.
Right, and this is all assuming you're under 65,
Right.
not eligible for Medicare. Right, so then there will be, and the rules are the ones that I don't know them all about how they determine your income and how far back they look and all those things. But it's an option for people. The goal is to keep people insured and insure people who are currently uninsured. So the things that are barriers, and for a lot of people, COBRA depends on what your job has been and what your income level is, whether COBRA is affordable. This will be another option for people when they leave work.
Yeah, and then just one more general question. I have a friend who was raised in England. She's now over here. She's been over here quite a while. Her sister's still over in England. They have socialized medicine over there, as they do in Canada. Her sister had a real bad situation that needed medical attention and several operations. And she had to jump through a lot of loops to get on the list, apparently the waiting list, to have this operation done. And over in England, apparently, you can get put on a waiting list for certain things, and you finally get them done. Or you can go to a private physician, pay a lot more money, but get it done immediately. And they have this kind of dual standard over there. Is this program, this Medicare program or healthcare program, are we going to see this happening? A doctor's going to say, Wood River Health Service is going to say, geez, if I went out on my own and became a private doctor, I could get more money for the same thing I'm doing here, because this new healthcare program regulates how much I can receive for such and such a procedure.
So I think, as Wood River will tell you, there's already doctors who go and say, I can make more money on my own practice.
Yeah.
But it's really important. What you're buying, if you go on the exchange, is private insurance like I get through my employer.
Right.
So we have built this reform on the private insurance system. So Medicare is a single-payer insurance system. It is not Medicare for all, and it is not which is like Canada. It is not like the British system, which is entirely government-run. All the doctors work for the government, which is, in our country, our VA system. This is built on private insurance, but it's a different way of paying for the insurance. So even in Rhode Island, if you have Medicaid, you have private insurance. It's through United Healthcare, it's through Neighborhood Health Plan, or it was through Blue Cross. It's not anymore. We're hoping they'll come back. It isn't, unless you're disabled or in long-term care, you're in managed care insurance just like I am in my state job. So it doesn't create a centralized state decision or government decision-making as you described. Medicare, we have some of that. And actually, as taxpayers, we need them to be thinking not about removing opportunities for people, but thinking about how they're going to manage a huge federal budget problem, because as we all age, we haven't got a way of financing that system adequately. So we need to think about how we pay for care and deliver care in a way that's more cost-effective, but still meets our needs. And as a government official, and I know you all can relate to this very much, there is something unique about healthcare. When you talk to people, it's not like how well you put the sidewalk or pave the road. That's really important, but this is about the people that we love. It's about our parents and our husbands and wives and our children. So it's not just the same as finding the cheapest way to do it. It needs to be more efficient and higher quality. That's one of our biggest challenges, and that is going to be a combination of citizen involvement, our medical community, which from my opinion has to be leading a lot of this charge, and government, because we pay a lot of the bills and we set a lot of the policies. But it's not going to be government dictation. It's going to be a lot of sometimes complicated but important work together to make those decisions as a community.
Are all the cards, one small question, are all the cards that people are eventually going to be carrying to present to the medical service provider or whoever, are they all going to be the same, or is there going to be some indication as to who is subsidized? Are we going to run into a food stamp?
No, I'm pretty sure, as is the case now, if you're on our Right Care program and you have a United card.
Right.
In the old days, you had a Medicaid card. But now, if you have insurance, you're going to have insurance.
Yeah.
So they're not going to, who knows what you pay is going to be who provides the subsidy to you. It's not going to be your physician.
Okay, thanks.
I just have a couple quick
Yes.
questions.
And I appreciate everybody's, I feel
Yes,
like I'm
thank you.
taking more time than,
Yes.
but I hope that it's helpful to people.
They're quick, I promise. Do you know?
Oh, no, I'm fine. I'll
Do you
talk
know-
forever.
Do you know where the exchange might be, and will there only be one exchange in the state?
There will be one public exchange. Some people work for large employers, and there are private exchanges already.
Oh.
So some big companies run exchanges internally. So you may in fact work with people who have access to choices within their employer. There will be one government-run exchange, and that's the one that's open to everybody, and that's the one where you will access the subsidies for coverage.
Where will that be, I guess? Will it just be an online exchange, or will it be actually a brick and mortar?
It's going to be an online exchange.
Okay.
There will be an office in Providence where they run it, but it is an online opportunity.
Yep. And say someone that's unemployed for a while goes on the exchange, picks their type of insurance, 6 months into the year, essentially, hey, I got a job. I don't really need this. My employer insurance is going to be a lot cheaper. Is there going to be a way to perhaps cancel that out?
Yes, absolutely.
Okay.
So let me also say, our goal is that people who have access to employer coverage stay with employer coverage. That's a very valuable resource in our healthcare system. One of the interesting things in Massachusetts is they expected, one, employers would drop coverage, and they've been doing it for 6 years, and two, that employees would end up on Medicaid. In fact, they've had a significant increase in employer-based coverage because people chose to go back on employer coverage. So we want people to stay on or go on. So it's not like you'll be penalized or you'll forfeit what you've paid. No, that will be, and actually we anticipate, unfortunately, because it'll be complicated, people will move back and forth based on hours they work, particularly seasonal employees. One of our goals is to make that as seamless as possible for the individual, but there will be a lot of that.
Okay. And then just a last quick comment. As far as the future meetings you had mentioned, I guess, are you going to, where's that on your website?
So if you go on healthcare.ri.gov,
Okay.
it is not a glamorous website. Don't take it as an example of what you will see, but it says all the meetings, public meetings that we have, where they are. So it's like a Secretary of State's resource.
Okay.
It is a Secretary of State's resource. And minutes from those meetings are on there. They are all public meetings. There's also an advisory board for the exchange, the online marketplace. That is a public meeting. So people are welcome to participate. We do our best. It varies, I'll be honest, based on what we're talking about, what time of day. We have frequent before work meetings because we're trying to have them at times when people are available. I also want to emphasize, and I think I might have ended up here because I went to Charlestown. Is that part of how I got invited? I'm trying to remember. I was in Charlestown. Somebody? I don't remember, but somebody noticed. I want to say that anytime you invite one of us to come out, we will come. So I've been at Rotary clubs, church groups, temples, trying to think all the other kinds of clubs. But please encourage people if they say, well, that would be valuable. I had a union group come up to me because they've got questions about which is a particularly complicated set of issues. So let's pass that word around. We are interested. It may not be me, it may be somebody else, but to come out and answer questions, be a public face, listen to concerns, but also just tell the story so people have a little more knowledge. So let people know that's available.
Yeah, we will. Thank you.
And as I said, we will answer the phone and the email, so.
Yeah. Does anyone else out in the public have any last comments for Lieutenant Governor Roberts? Okay,
Well,
I
let me-
want to appreciate your time, and we've got a little token the council got on behalf of the
Thank
clerk's
you.
office. We got some flowers and some local goods from the Town of Hopkinton.
Thank you very much.
Some maple syrup and some jam from a local farm.
Great.
Which is that Ocean?
Well, and I just want to thank the council, but also the members of the public who came tonight. Oh, thank you. Oh, the mug's awesome. Thank you very much.
Another box.
Oh, thank you. Yeah, do you want to have the council president with me? Great, thank you.
Thank you very much. I appreciate your time. Thank you.
Thank you, Mr.
Thank you so much for coming.
Nice to meet you. Thank you very much. It's a pleasure. Oh, yes. So these are the frequently asked questions for small business. So for anybody that doesn't know, and it has the web information and some other resources for you.
Thank you so much.
I want to make sure Lillian gets a copy of that.
I'm going to take a quick five-minute recess.
I have a picture taken to help.
All right, we're going to resume our meeting after a 5-minute recess. Need a motion to sit as a licensing board?
So moved.
All those in favor?
Aye.
Aye. First hearing is to open a hearing on an application for a special event permit filed by the Charahoe Athletic Association for a fall festival fundraising event scheduled for Thursday, September 26, 2013, from 6 p.m. to 11 p.m. Friday, September 27, 2013, from 6 p.m. to 11 p.m. Saturday, September 28, 2013, from 12 p.m. to 11 p.m., and Sunday, September 29, 2013, from 12 p.m. to 6 p.m. at the Dow Field Complex located at 1118 Main Street, Hope Valley, Rhode Island, jointly sponsored by the Charahoe Athletic Association and Northeast Midways, 308 Hopkins Hill Road, Coventry, Rhode Island, continued from June 3rd, 2013. I know the applicant is here, Mr. Apisi. Everything's complete, right, Lisa, and all that good stuff?
Yes, they filed a $100 filing fee as well.
Yeah, Mr. Apisi, I guess you want to just fill us in. I think this is your second year doing this event?
Yes, it is, yep.
Okay.
Last year, we started out, we had a 3-day event. Unfortunately, Mother Nature didn't agree with us, and we rained out Saturday and Sunday, but we learned a lot. We gained a lot of volunteers, so it was worth anyway, having it. This year, we're going to expand it a little bit, change a few things, and hopefully it'll be a success this year. We're going to keep plugging till it is, so.
Yeah, right. Thank you, thank you. Council have any questions? We'll start with Scott.
Well, I just wish you well and thanks for your support of the community.
Thank you.
Scott.
How'd you deal with the parking? How'd people park? Where did
Well,
they
what we
park?
did is we had the 3 small lots at the complex, and then what we did is we got the lot off of Bank Street, next to the cemetery.
Oh, right.
I worked a deal with them. We we cut it and we lined it, and we had parking attendants there. That was the biggest key to the success of this, was we had plenty of volunteers to do parking. We also had Woodmansee Insurance parking lot to use, so the community has helped. Pastor at the church offered his lot when there wasn't church in session. So as far as I'm concerned, the only thing I'm worried about is parking if it does go off really well. We're prepared to have shuttle buses if we have to at a later, you know what I mean? We're not sure. It's new. A lot of people were scared to come last year, vendors, because it was new, and everybody was already pre-booked. But we got everything in place, and we got a lot of people involved, so hopefully it'll go off well. And I'm still working with the Bushies to try to use his field for parking, so that's still, we're gonna use that big field down behind the Bushies' house for hay rides and pony rides, but it's not an easy thing to get his field for parking, but I'm working on it, so.
Yes, Barbara.
I think my concern was the parking and the traffic and the control of people walking across the street. Because I know last year that was one of the issues that I had heard too, is that the parking was a problem. traffic control? Because
Yep.
it's, Route 3 is a very busy road, especially on the weekends, and then people crossing, because they all had to cross very busy traffic.
Right.
So I think that's still one of my concerns, and it sounds like you are trying to work on it and trying to address it and trying to find ways to make that work. And it seems to me that it's certainly worth doing it to try to figure it out.
Yeah.
And you can only figure it out by doing it, actually.
Yeah.
So I know that was a big concern for me, because Route 3 is a business corridor, and the businesses need people to actually get to them, not
Right.
just get blocked up.
Yeah.
And then on top of it, getting children across the street, if they're going to park in a, Woodmansey's or something like
Right.
that, you'd have a lot of small children.
Yeah.
So I think that's still one of my concerns, and it's certainly worth trying it again and to
Yep.
see how you certainly learned a lot, and will then be able to see what you do.
Yep.
'Cause I know that's a concern.
Yeah, I don't know, I didn't know that we had a problem with that last year, because we had an officer, a Hopkinton officer there through the whole festival.
Are you gonna have more than, how many?
Well, what we did
officers
is
are
we
you
ended
gonna
up getting extra
Okay,
police
so
last year,
maybe-
because I wanted one patrolling the grounds.
have? Sure.
Because at night, festivities like that, you tend to get the kids bundled up, so we didn't want things happening that shouldn't be happening there. So we did add police protection.
And you've
But-
added this year too.
And yes, so I've already reserved the officers, 2 of them for each hour that we're there, and also a patrol car. And like I said, we had 2 to 4 people at every lot. So we filed them in and out. And I don't know, to me, what I seen, because I was in and about the whole place the whole time, the community was a buzz. I mean, there was people walking down the streets, the community was a buzz. And I don't think it was so much a problem with traffic. It was basically, the community was alive. People were walking down the streets with their kids and coming to the festival, and that was our goal. So,
Yes, thanks, Bob. David?
I think it's a great idea. I looked up around the corner from this, and I think it's just wonderful, especially if you make some money on it. And it doesn't rain. You're assuring me that there's going to be an officer at the street right there.
Oh, yeah.
Directing traffic. Okay, so you've hired somebody.
I've already booked the Hopkinton Police already for patrols.
Excellent.
It's already been done. And,
And somebody wandering the grounds also.
and someone wandering the grounds. Yep, oh yeah, and if need be, if we need to add a 3rd, we will. And they worked very well with us. They allowed us to have them there, and if it was slow, to let them go. It was a 4-hour, because it's union, it's 4 hours. So every 4 hours, if it looked like it was slow, we could let one go, as to save money. But everybody's been working very well with us, so
That's great.
I have high hopes of it being a success,
No
though.
fireworks or anything like that?
No fireworks. The only thing we're gonna do a little different this year is we had music last year,
Yep.
and we plan on having live music this year for 2 nights. The other thing we didn't have last year is exhibitions, and this year we're gonna have like the Jaws of Life, the Hope Valley Fire is gonna rip a car apart. We're gonna have different, like the dance studios there, the karate studios there. Maybe a few more animals, because we got the area now.
Right.
What we did is we moved it to Dow Field near the playground this year. Instead of having it in the front lot, we're having it in the big lot.
Yep.
So we changed locations, and, like I said, we learned. So hopefully,
Not going to be any complaints from the neighbors with the live bands playing?
well, I'm hoping not. What we're doing is we're putting them back near the river. See, last year we were up front, and we had the DJ right near the Little League concession booth. Okay, it worked well. This year, we're gonna put, where the Dow Field concession is way down back, down by the river facing toward Main Street. So, we're trying to do it the right way. Hopefully, we don't have any complaints, because I don't think we had any complaints for what we did last year, so.
So it was good for the day or two that it lasted, but-
Well, yeah, it was very nice, but it was a lot of work from a lot of people, and then the weather came, but that's the chances we take. We did move it a little sooner this year. We moved it off the October weekend to September, so.
Thank you.
Great.
Anyone out in the public wishing to be heard on this matter?
I'd
Okay.
like to make a motion for the special event permit filed by the Charahoe Athletic Association for a fall festival fundraising event scheduled for September 26th through September 29th at the Dow Field Complex in Hope Valley. with the waiver of filing fee.
Second.
All those in favor?
Aye.
Aye.
Good luck.
Thank you very much.
Yes, sir, please. Thank you, appreciate it. Okay, need a motion to adjourn as a licensing board
So
and
moved.
reconvene as
Second.
council. Okay.
All in
Next
favor?
on the agenda is...
All in favor?
Oh, I'm sorry, all in favor?
Aye.
Aye, sorry. Continue the hearing, next on the agenda is to continue the hearing for the sole purposes of receipt of the planning board recommendation and hearing from the building official on the zoning ordinance amendment to the zoning map and zoning ordinance language amendment. Petitions are filed by Christine Austin and Amy Vachon, doing business as The Kids Co., for property located at 1111 Main Street, Hope Valley. Property owned by the Phoenix Group, 2 William Street, Providence, Rhode Island. Identified as Assessor's Plat 28, Lot 133, a neighborhood business zone with uses limited to real estate offices or professional offices. The applicants request an amendment to the August 5th, 1985 Town Council decision that approved a limited use change in a neighborhood business zone to include a daycare center as a permitted use together with the previously approved uses of real estate office and professional offices, and the applicants request a language amendment to Section 5 District Use Regulations to include a daycare center designation as specified below, and to request a language amendment to Section 5A Groundwater and Wellhead Protection Ordinance to create a land use category of daycare center, also specified below. The petitions are filed in accordance with Chapter 134, Section 16 of the Zoning Ordinance of the Town of Hopkinton, as amended, continued from June 3rd, 2013. The applicants are present. I guess we'll probably start with Mr. Ward. Our building official, Brad Ward.
I was asked to attend tonight. I don't know. Are there any specific questions that you guys have on this matter?
Well, I think from my perspective, maybe from the council, I can't speak for the council, but I know you inspected the property. Maybe you can kind of tell us, I guess, from your perspective on the category use change from right now it has two classifications, a professional office and what is it? Real estate. So, making it a separate use category, I don't think is a big stretch from my perspective, but I think maybe you can expand on that if you think there's any.
The use change and the hurdles that come over it are more geared for the building code than the zoning ordinance. It's relatively a minor zoner change of what they're looking for. I think I did plan on incorporating this into the new zoning ordinance as far as a daycare center, and I actually think it would be a good idea, and not on these people's dime, but to even establish an adult daycare center that might permit the adult daycares in RFR 80 zones. I don't mean to digress, but I'm just giving you a little brief history of the daycare plans that I had in the new ordinance. With respect to the building itself, I did read the planner's memo, and from a building code standpoint, the basement is not considered a story, and it is only 2 stories, it's not 3 stories. So with 2 stories, and it will require sprinklers or a variance from the State Building Code Commissioner not to with kids in there. It is way below the maximum square footage. I mean, you can get up on 1 story to 9,000 square feet without sprinklers. The thing that requires the sprinklers is the 2 stories, and they're only talking 1,200 square feet, so is what I read in their application. So from that standpoint, that certainly will be addressed. We have been discussing with Mr. Aubin to pursue a variance from the state board. I can't guarantee, I don't have a crystal ball, what the outcome of that will be. I've made some recommendations to them, and hopefully they'll be able to come to some consensus of the board. I do have to be up there for that. I was talking to the State Building Code Commissioner, and it looks like that can be arranged for August timetable. There are some things that the applicant has to do in order to get his application set for that avenue. With respect to the septic system, which I did hear there are concerns, there are state laws that prohibit me from issuing the building permit until I know that an SSD, system suitability determination, has been approved by the DEM. Upon approval of that, I can issue the permit, or If for some reason it is denied, with stamp plans and an upgrade and approved ISDS repair to that system, I will be able to issue the permit. I won't be able to issue the certificate of occupancy until the state DEM certifies that the system was installed according to their approval process.
Okay, thanks, Brad. David, I'll start on your side. Do you have any, okay, Barbara, do you have any questions for Brad
no,
relative to this applicant?
No, I was at the planning board meeting, so I listened to a lot of the issues that Jim Lampier has written in his advisory opinion, so no, I'm clear.
Okay, Sylvia.
I'd like to point out that if, I mean, you folks got the ISDS that was handed out back in 1989, the application date, where it specifically noted 16 employees maximum and no high water usage. What I would like to do, I would like to see the council do the minimum amount, and I hope that we can determine what is the minimum amount that we can approve to allow the business to go forward, but protecting other neighborhood businesses townwide. And specifically, my concern has to do with most neighborhood businesses are small, usually small lots, and we do have a lot of small lot neighborhood businesses around town. I would like to see us add a new category, because we don't have that in our zoning ordinance. But my question, and I know you don't like to, Pat, could you listen to me specifically on this one?
I'm listening.
Oh, good, okay. What I'd like to do, if we could, at the minimum, is allow the new category, but note that currently what is allowed is, as the council president noted, that there is, it's a neighborhood business special, and it currently allows the real estate and the professional office. What I'd like to see us do is add to that this daycare facility, and then the state can figure out, as it will anyway, the septic issues. I do not want to see us put down that neighborhood businesses townwide, whatever those whatever how small they are, can have daycare facilities in them. So I'd like to keep that as an N, but if in the past a council allowed 2 activities on this lot, can we then allow 1 more? And add this category in?
Special use.
Is that possible? That's, I'm trying to find, from my point of view, my concerns. I'm just trying, is there a way to avoid having daycare facilities allowed townwide?
Special use
with
permit.
business?
That's all. Right?
Pat, do you want me to answer this, or you?
No,
Or at least,
I don't
okay.
want you to answer, but I
Okay.
think Frank just did, which is, if you're uncomfortable with making it permitted in a neighborhood business zone, then you make it by special use permit so that it has to go before the zoning board. I mean, that would be the cleanest way to do it.
Okay. Well, I'd urge the council to, at a minimum, at least do that. I'd rather not deny rather not say no, but you've heard my concerns.
Scott?
I think Bob wants to say.
Well, I'm going to continue. Hold on.
Okay, first of all, I think it's important that we have, and I want to work with these people because I think there's a need in the community, but I also thought Brad brought up an important point about daycare. I know that all these people are living longer, and taking care of elderly parents is a legitimate concern, and as well as doing something with young children, since most father and mothers work in this society. So I think it's, but I'm concerned about the thing about the neighborhood business and the acreage, and I think Sylvia brings up an important point, but in a special use permit, the zoning board could take into consideration the acreage of that type of business and how much land you would need to put something in, especially if you have other businesses in that same area. I would like to ask the building inspector, did you look at the traffic flow situation at all? Because that was part of the...
I really haven't, that's really not my, that's more of a
Okay.
planning board
I'm
requirement
sorry.
than than a
Okay.
building code or zoning aspect.
Okay. And the limit of children, because I believe there was a limit of children on that property too, how many they could take, and there was a cap on it, if I remember correctly.
Via the state, 20.
Mr. Orban,
16 children.
Yeah, they said they were hoping.
I mean, 16 employees,
Right.
as they worded it.
I don't think they said the state capped it at 24.
Yes, they did. The state capped you at 20.
That place, I believe, by
Mr.
state
Orban.
licensing,
Come to the microphone, one of the microphones.
by a function... Yes. John Orban. By a function of the state licensing and the square footage that's being proposed for the use, the limitation would be 20 students, depending on what DEM's, getting back to the Councilwoman's question with regard to the septic system, depending on what DEM's flow is per number of students at a daycare facility with 16 employees, I believe it was 15 gallons per day. I'm not sure, I'm not a septic and design engineer, so I'm not sure exactly what that flow number is, but that'll be the function of, that'll give us how many students are allowed under that existing septic system, and then obviously expansion would have to be something someone, as the building official was speaking to, apply the whole process of designing and applying to DEM for that expansion of the system.
Yeah, thanks, Mr. Orban.
and that SSD will also have to include the current uses there as far as a dental office and any other uses that occur on the property.
I would be inclined for the special use permit because it would require the zoning board to look at it, and the only other thing I see, and it's probably not relevant, I think at sometime in the future, our successors, as the council, will probably look at manufacturing zones, because if we ever did get a big company here, they might seem to be obliged to provide some type of daycare for children also. Apparently it's not needed now, but I can see that sometime in the future. That's just an observation. But I appreciate the special use permit aspect.
You all set, Scott?
Yes.
Thank you. Barbara, do you have one more?
Yes. I didn't have a comment because I don't have any problems with a daycare center under any circumstance in a neighborhood business zone. I believe that it should be permitted, not a special use permit. I believe that the planning board will go over all of the special use and the all of the different problems and concerns people have with a daycare center would reasonably go under the planning board's jurisdiction. It's a neighborhood business is the zone. A daycare center is perfectly acceptable in neighborhood business in any of our towns in Hopkinton. I have no issues with it whatsoever, nor do I wish it a special use permit, because I don't want people always having to jump through hoops with the zoning board and the planning board for something that is a reasonable business in a neighborhood zone. It is the best area, better than RFR 80 and better than R1 when you have a daycare center specifically assisting parents who are working.
Thank you, Barbara. David?
Good comment. It's been long said that Hopkinton is anti-business. I don't think we're anti-business. I think what we are is not pro-business. I just don't think we go out there and support people who want to start a business here. Keeping that in mind, I just don't see any conflict between a daycare center and a neighborhood business zone. I just don't see it. I can't imagine where there would be a conflict between one business and a daycare center, any kind of business. So I think it's the proper zone. I agree with Barbara. I think it's the proper zone to put a daycare in. I'd rather see it there than certainly than in a residential area. So that's how I stand.
Thanks. You know, tonight we're not making a decision. We're just hearing testimony from Brad's office and Mr. Lampier. But Brad, I just had one quick question for you. And I do echo the sentiments of Councilors Capalvo and Husband on the neighborhood business. The only thing, if as the other two councils has suggested, if they wanted to put a special use permit restriction in that zone for this particular entity, correct me if I'm wrong, I believe that you wouldn't have to get an aquifer permit if you went ahead with a special use permit.
If you put the special use, then, and you maintained the A status in the aquifer, allowing it to go forward in the aquifer, then no, they wouldn't need the permit, so they would...
That to me would be a win-win, I guess, in that regard.
Yeah,
But
it'd have to be the P status, excuse me, I said it backwards on that, right, so...
I'd like to ask a question.
Hold on, Scott.
As long as in both the primary and secondary, you had a permitted status in the aquifer protection, it would just be limited to the special use permit and a public hearing and certification before the zoning board. So it would require 2 additional meetings for the applicant in order to even get the use approved.
All right. You had one more comment?
Yes.
For Brad?
Well, I have a question. You might not be able to answer it, but does anybody know how many other towns require a special use permit to do this type of activity, or how many people they just do it routinely?
No idea.
Because I don't have an answer to that question.
Well, maybe you can look online. I don't know. You know, Brad's here to answer as it pertains to our
I'm
town.
very familiar with Hopkinton zoning ordinance. I really don't go looking and comparing because Hopkinton has its own unique characteristics, and the zoning ordinance is tailored to it and its residents.
Anyone else have any questions for Brad? City councils?
I
Okay.
do.
Yes, Pat.
Do you mind?
Yes, please.
Brad, do you have any issue with this new proposed use and the way it's being proposed? In other words, with a special use permit for the 2 RFR zones or the 2 residential zones, and then permitted neighborhood business, permitted commercial, not permitted manufacturing. Does that all, do you see that as working okay?
I see it as working, and maybe we might want to consider not having one in a residential zone. They have a residential home daycare that's limited to 8 occupants, and that could be licensed through the state, and it's approved by the state. No sprinklers are required. And that in an R1 zone, I think that would be more applicable use and using the home daycare center, because usually in the R1 zones, you do have a lot of people on top of one another, very small lots. And when you put the exterior playground out there, kids can be rather noisy. Again, I was, not to reiterate myself, I was explaining an adult daycare center, though, would be maybe okay in that zone, because I don't see them hooting and hollering and screaming out on the monkey bars, no offense. So that would be my only concern, but if the council feels adequate that it is okay to go forward with a special use permit, I certainly would accept your judgment. That's
And that's just the R1 zone?
that was just the R1. I have no concerns over the RFR 80. As long as they meet all the state criteria and building code requirements, I have no concerns with it being permitted in the neighborhood business zoning as discussed, or in the commercial. I think Councilman Hurst brought up a good point with the manufacturing, and maybe we do need to put an S in there, so that if there are businesses that want to come into town and provide daycare services for their employees, we shouldn't have to make them jump through hoops. And maybe, I don't know if an asterisk could be put to it, that it can only be done as accessory use to a business. That might be some way to quantify that, to put a footnote onto it. That way it's just not going on a manufacturing lot as an independent entity.
Thank you.
Thanks, Brad. Thank you, Brad. Next up, Mr. Lampier. We all received your memorandum, I guess, regarding your opinion of the advisory opinion. We've all read it, I assume, and I guess I'll start with David. I guess you have any questions for Jim relative to his findings?
I don't at this moment, no. I
Okay.
read it, yep.
Barbara?
I don't at this moment.
Okay.
I read it, and I was at the planning board meeting.
Yes. Sylvia?
No.
Can't find it.
Okay. Scott?
No.
Geez, okay, well, I'm going to ask you a couple questions. How's that? In your facts, I was a little confused on the terminology that was in here. I was at the planning board meeting along with Barbara, and my understanding was, I think, correct me if I'm wrong, we walked away with, I think, a site review plan was one of the main things that the planning board wanted, which is fine, and all that comes with that traffic or whatever it was. And then the only thing I don't remember, which was a development plan. It mentions here, development plan review in your decision on page 3. It mentions it's really not applicable. And then on your decision on page 4, decision on amendment 2, you're stating that a development plan review was required. Now, in between that time when this was submitted to us, I did call the solicitor, and she had checked with Scott, our solicitor for the planning. I guess they're synonymous with being the same, a site review plan and a development plan review?
Correct.
Okay, so I guess the planning lingo threw me off. I thought it was another hoop to jump through, and I just wanted to make sure that it wasn't being asked of the applicants to do another thing other than what was stated in the planning board's meeting.
Those two terms are used interchangeably.
Okay.
Thank you.
Thank you. Mr. Alban?
I was just going to say, I think maybe the best way to handle that condition as requested by the planning board would be that development move forward in accordance with the subdivision land development regulations, which I believe is the operational statute for development plan review.
Well, development plan review is an ordinance that is outside of the land development.
Is that design review or development plan review? I just need to know where we're...
Okay. We call it development plan review, and it's in our code of ordinances. It's separate from our land development and subdivision regulations, which embedded in which is design review. If you've read them, I understand. Yeah. Okay. Well, development plan review or site plan review is another ordinance in town that applies to any activity that requires a building permit, with the exception of single-family homes and two-family homes. Any commercial activity that requires a building permit is required by ordinance to go before the planning board for what we call development plan review. Now, when they do that, a lot of these issues that the council raised last public hearing and that the planning board had on June 5th will be, taken up at that point in time. And again, that's particular to each site where a daycare center may be proposed. Every site is unique, every site is different, has its own set of challenges, and that's what the planning board is there for to do, is to see how that use, daycare center, can be woven into that particular lot.
My only concern is just making sure we identify, what further processes that we need to go forward with, and if it's a, development plan review through your office, I just want to make sure we don't, get to the planning board and then, the solicitor says, well, we've got to do design, do land development plan review under the subdivision regs.
Well, that'd be up to you to make sure you're on top of that, Mr. Robin.
Oh, I'm just trying to make sure what the planning board's asking for.
Okay. Any other questions?
And just one more thing, I just wanted to let the council know, we are working with a design engineer, a civil engineer, as far as the site plan goes, looking at the issues that were identified by the planning board vis-a-vis traffic circulation, as I already stated, system suitability determination, also preparing a physical alteration permit, which is the Rhode Island Department of Transportation process for monitoring land uses along state highways, Route 3 being a state highway.
Thank you, Mr. Alban. Okay, any other comments, Jim?
I could give you a brief summary of it if you want, but I don't think you want me to read the 4-page memo. But
no, we're good.
But simply put, the applicant is asking for two things. Number one, to establish a use in our table called daycare center. Once that's established, however you folks decide to establish it, whether you want to put all P's across there, S's or N's, that's for you to decide, okay? And then the second part of their request is to, if that is allowed in neighborhood business zone, to make sure that it's allowed on that particular parcel. So, because right now there's a restriction on that parcel, only 2 uses. You know all this.
Yes, Scott.
Jim, and I don't expect you to know the answer, but from your experience as a planner, is something like this, would that normally require a special use permit or not? And I know you worked in other towns other than Hopkinton. I'm trying to make a logical decision, and
Well, we're not making a decision.
no, I know we're not making a decision tonight, but I'm just saying is in the process, because I'll probably end up contacting Jan Beardsley, but...
Isn't this the kind of thing, Jim, that would be very specific to a community, a given community?
Absolutely. I'm sure every community does it a little bit differently. You can't compare, use tables from town to town. But I would say, in generally speaking, I think the special use permit is really useful when you're talking about the more, what's the word? More challenging uses to a community, more detrimental uses, okay, such as the heavy commercial stuff. If you want another set of eyes to look at it, or if you have questions, or particularly in a certain zone, like if you have trepidations about this going into a residential area, which is valid, the special use permit is another check. You go before the zoning board to make sure that the criteria they use that meets on that particular site. It all depends on the use, how threatening you perceive that use to be. A daycare center, I don't view it as a toxic use. I mean, as a aquifer protection permit for something like that, I really can't see the need for it. And again, it all depends on where it goes. A neighborhood business zone, I think it probably is appropriate. Daycare center appropriate for a neighborhood business zone. Again, in this particular case, you're going to have 20 children there. It's not an 8-child facility that you'd have in a residence. So, neighborhood business implies a business zone for 20 children. I think it's appropriate. But if you have trepidations about it, a special use permit is the way to put another check on there. You'd have 2 boards to go before.
In addition to state licensing, review by the state fire marshal, state building official, and the other voluminous reviews that Christine and Amy have talked about in front of the council and the planning board. My opinion on it vis-a-vis the special use permit is, as Jim said, it's an innocuous land use daycare center facility. With regard to Councilwoman Thompson's concerns as far as it being located on a small lot.
He needs to stop.
Oh, I'm sorry.
Okay. I'd like to make a motion to close the hearing and set a date for a decision. Second.
Any more discussion? All those in favor?
Aye.
Aye. Lisa, next, when is...
The next regularly scheduled meeting is July 1st.
Okay.
And I'm there for then.
It's fine with me.
Can't see why not.
Council President, thank you.
Thank you.
Thank you.
Thank you, ladies.
Thank you. Okay. Next on the agenda is the consent agenda to approve the May 7th, 2013 Financial Town Assembly minute meetings. Accept the following report, Town Clerk, approve refunds submitted by the tax collector.
So moved.
Second.
All those in favor?
Aye.
Aye. First public forum. Jeez. I feel like we had a public forum.
Public is
Anyway.
out.
Town employees.
Our public is
Okay,
out.
having heard none, okay. Next up is Mr. McGarry, Town Manager's Report.
Thank you. June 5th, I attended the monthly planning board meeting to hear a presentation made by Jim Reardon of Fuss & O'Neill on the proposed stormwater management plan. Planner Jim Lamfair placed this item on the agenda to obtain the planning board's input and familiarize themselves with all aspects of the plan. Council President Frank Landolfi and Councilor Barbara Capalbo, liaison to the planning board, also attended that meeting. Secondly, on June 6th, an inspection of the Beechwood Estates subdivision was conducted by Jim Lamfair, Tim Teff, Dave Caswell, Sean Martin of Fuss & O'Neill, Rick Ruder of Pursuant Properties, and Chris Duhamel of Dupree Engineering, and myself. The developer had indicated an interest in turning the subdivision roads over to the town. However, there still exists some unfinished work, such as final coat of asphalt on the subdivision's 2 roadways, drainage work, and other less intrusive improvements. The developer is eager to make these improvements and plans to do so during the summer months of this year. And last Friday, Tim Teft and Dave Caswell and Sean Martin again went out to the site just to go over all of those suggested improvements. And this afternoon, I received a two-page memo from Sean Martin from Fuss & O'Neill, kind of like a punch list of things to do that will be forwarded to concerned properties. And we're also in the process of obtaining an as-built from the engineer, Chris Duhamel, at which time it'll be turned over to our engineer, and then hopefully with some negotiation, we'll arrive at a conclusion as to what exactly has to be done, and hopefully that entire project should be completed by Labor Day of this year. On June 13th, I convened a meeting of the department heads to review the town's performance evaluation management system and provide rated training to supervisors. The meeting included a review of the policy, its rating forms, assignments, rating categories, errors, and standards of performance. This system goes into effect July 1st of this year for town full-time and permanent full-time employees, permanent part-time employees. The system is basically designed to measure employees' on-the-job work performance, identify training needs, and serve as a daily link between supervisors and employees. And this will allow the town to evaluate its employees on an annual basis and be able to document in a written, standardized, and equitable manner.
Thanks, Bill.
Thank
Any
you.
questions for Bill?
Just, where is Beechwood Estates?
It's right off Route 91. If you travel down Route 16, Route 216,
Yeah,
you take a left on Route 91.
okay.
It's about a half a mile on the left-hand side.
Oh, okay. That's been there.
Kind of tucked away. It's been
Been
there
there for a long time, hasn't it?
about 9 years, I think.
I mean, like decades.
No,
No.
No?
no, it's new. Well, it's
New?
like Bill said, in the last 9 years or so.
Yeah, well, 8 or 9 years is 10.
I think it was 2004.
Well, not decades, so.
Yes, 10 years.
Yeah, 10 years.
Yeah.
In like 4 or 5 months.
Well, you want to get specific, that's a
No,
decade.
no,
I mean,
it's-
it's not been there for 50 years.
No, it hasn't been there for 50 years, but 10 is a lot. So they're finally trying to finish, is that what they're saying? Is they're finally trying to finish, so now they would like us to take on the roads, but you're going to make sure that they're really up to our snuff before we take them on?
Address
Well,
it to Bill.
Because
The
after 10
two-page-
years, they'd be really
Barbara,
damaged.
address it to Bill, because it's...
The two-page report that was prepared by our engineer from Fuss & O'Neill was very extensive.
Oh, great.
I mean,
Great,
it's a two-page list of things that they have to do, have to accomplish, not only engineering feats, but also construction work in order to even have the town consider approving.
That's great. My concern is that it's been so long, I mean, those roads have to be a mess. So I'm really glad that Fuss & O'Neill and the rest of you have gotten together on that. Thank you, that was my concern, is to make sure that we're making sure they're doing all the work they need to do.
I hope all developments don't take that long for us to take over the roads.
Me too.
Bill's on top of it.
Yes.
Thank God. Okay.
Okay, thank you, Bill.
You're welcome.
Next, under new business, the first item under new business is to consider and vote on adoption of an alternative budget pursuant to Charter Section 2370, flat municipal budget, with recommendations as proposed by the town manager and finance director. Our municipal budget, as everyone knows, was defeated by the electorate on June 11th, and we, as a town, dictated by charter, I think Section 2370 to go with last year's flat municipal budget, so that what that results in is about $36,600 less, and Bill, our manager, and Laura, our finance director, came up with some suggestions, and I'll turn it over to them relative to this.
Thank you. With respect to the adoption of the FY 2014 alternate budget, I sat down at length several times with Finance Director Laura Kenyon, and we put together the following memo that I'd just like to read into the record, if I could, please. The FY 2014 proposed town budget, as the Town Council President stated, in the amount of $24,589,171 was rejected by the electorate on June 11th, 2013. Consequently, and consistent with the town charter, the town shall revert to its alternate town budget in the amount of $24,552.492. Let me try that again. $24,552,492. This alternate town budget will require a reduction of expenses in the amount of $36,679. Laura Kenyon and myself recommend that the funds to offset the reduction of expenses come from the capital improvement plan in that amount. More specifically, the capital improvement line is to be revised as the Public Works Equipment and Vehicle Project. There is currently $65,000 set aside for the first-year lease of a street sweeper in the CIP for FY 2014. Use of the $36,679 to offset the reduction of expenses in the alternate town budget would leave $28,321 remaining in the line item. If the remaining funding for the street sweeper is insufficient to acquire the equipment in FY 2014, the project may still move forward under a future RFP that stipulates either monthly, quarterly, or semi-annual payment options rather than the annual payment options, or the town may just delay the acquisition for 1 year. In addition, the town has taken no action so far to acquire a street sweeper. Therefore, there's no real adverse impact at this time. And finally, the funding to offset the reduction of expenses comes from the CIP, not from the town's operating budget. No town individual department budgets are affected. Consequently, in the opinion of Finance Director Laura Kenyon and myself, the use of these funds represents the lowest minimal impact on the town's FY 2014 annual budget.
Okay, thanks, Bill. Any council questions?
No, I think
No?
that's acceptable.
Okay.
Brian?
Yes, David.
I'd like to talk about this a bit. Tim, can I ask you a question? What's your opinion on this situation?
I know we're going to do to balance out the budget, but like I told you, the sweep is in bad shape. If it makes it, fine. If it doesn't, we don't have a sweep.
Have you had it working this year at all?
We use it, yep.
And does it work adequately at this point?
It works as good as, it's never been a good sweeper, okay?
Right.
It does work at this point, and it may make it, but.
I guess thank you, Tim. I guess the reason why I'm bringing this up is because I'd like to see the money removed from another area, and I hate to see us lose something that we think we need, and Tim thinks we need, and I think we need as a new street sweeper. And so I'd like to recommend that we take that money from the town hall expansion allocation that we've got in the budget right now, in the capital improvement budget. It's not going to take all of it. Obviously, it's only going to take $36,679. It will keep the money in the street sweeper account so that we could acquire one. And I'm not too sure, and I've said this before and I'll say it again, I'm not too sure that the referendum on the town hall last July, was defeated because the people didn't want us to spend $1.6 billion on expanding the town hall. Now, there's a difference of opinion here. I'm sure some feel that people didn't want us to go out to bond, and that's why it was defeated. I'm not sure I believe that at all. I have a feeling that a lot of people voted against that because they didn't want us spending that kind of money to expand the town hall. I think it's a nice idea to expand the town hall. I think we've got town offices in 3 different buildings, and I think and some of them are upstairs where people have a hard time going upstairs, can't get to, you have to come down and meet people. I don't think that's right. But at the same time, that referendum vote bothers me last year, and as a result, I'd rather see the money come out of the out of that town hall expansion. There'll still be money put in there. It'll just be $36,000 and change left, less money put in. That's how I feel.
Thank you, David. Barbara?
I'm on a similar mindset, but not exact. I also want the money to continue going to the town hall. We have to get people out of buildings. We have to get the town manager out of Crandall House. We have to because of the Crandall House charter. We have to get them out of the planning and building, planning department has to get out, and the finance department has to get out of a place where no one can get to them unless they can walk up steps. I don't see any alternative to that. We have to expand our town hall. However, I also really want my sweeper. And I want the sweeper because I live in an R1 area. I live where there are dozens and dozens of children. And that sweeper cleans those streets so the kids on their skateboards and their bicycles, and they walk everywhere. And we, of course, have no sidewalks, which I am perfectly happy not to have. But I really would like a good sweeper because we leave so much sand and rocks left over that the children get injured. What I was going to propose is perhaps we could split it. We could put 15,000 off of the sweeper and try to organize a new plan and take the other 18,000 off the sweeper and 18,000 off the town hall. So we have a split. That way we really can work on getting the sweeper, and at the same time not very much money comes off the town hall. Because I don't want to take 38 off the town hall. We really need it.
It's a good idea.
I don't want to lose the sweeper.
And I mean, my kid...
I really don't want to lose that sweeper. I absolutely believe, Tim, that sweeper needs to be replaced.
And you should see the children sliding on the sand. And I know the sweeper did the best job it could, and I'm not asking you to re-sweep, but boy, that would be nice too.
Mr. President?
Yes.
Can I say that I don't think that removing 36,000 and change from the town hall expansion item in the capital improvement budget is going to set the town hall expansion plans back a whole year or something like that. I mean, 2 years from now, we can add an extra 36,000 if we want to. And we can still have the street sweeper as a result if we do something like that this year. That's how I feel.
Yeah, thanks. I appreciate your comments.
We also do 1818.
I heard from Barbara.
Did you hear what Barbara said, though? You were busy asking a question. Did you hear her alternative? She had an alternative.
No, I didn't hear that. I'm sorry.
The alternative is, I agree with David, but I also agree with Tim Teft, is do 1818. 18,000 off the sweeper, 18,000 off the town hall. That way we definitely know we have enough money to buy the sweeper.
Do we?
We should. I mean, we should be able to find the 18 or do a quarterly plan or a half-year plan.
You lease it at a certain time of the year.
Right. And they still have to go into the bid process to buy it. And I think 18,000 off the town hall is not very much. Is easily replaceable.
Okay, hold on one second, Scott. Bill, did you?
Okay, well, I mean, I appreciate your comments. The only thing that I would like to say is that, I mean, it's almost July 1st now. And, you know, by the time we go out with an RFP and award the bid and purchase it, that's going to be several months, and it'll be the winter, and you don't do that in the winter. So perhaps the first time we're going to need this new sweeper is in March of next year. And there's certainly enough money in the CIP that's remaining, the $28,321 to pay for that. So I mean, you don't need a whole year's worth of money, fiscal year money for the sweeper right up front.
Right.
Yeah,
And that's not even including the possibility of negotiating the payments to make them either monthly or quarterly as opposed to annually. So even if you had an annual payment, it wouldn't start till like March of next year, or you could even further reduce it by multiple payments. So I'm not saying, what I'm saying is you're not going to have that big one whack where you're going to have to need that money right away, July 1st.
Well, I figured we wouldn't get the sweeper till next year anyway.
We're not going to pay for it yet.
Right.
Okay. Yes, Sylvia.
Oh, well, then I'd prefer to go along with the finance and town manager then, because we're not going to buy it until almost the year's over anyway.
It's okay with me.
Scott, did you have a question?
Yeah, I wanted to publicly associate my remarks with Councilor Husbands. I voted for the town hall expansion, voted for the budget this year, and I think and I wrote a letter as well as Councilor Thompson. But I had people approach me on their own in the brick oven, Dunkin' Donuts and Ashway, concerned about the town hall expansion, and I support it. But I think that we should get the sweeper. It's my understanding on the leasing part that a lot of times towns do the sweeping at the same time, so there's always a problem, I think, getting the lease. As far as moving the town manager back, years ago, this room right here was divided, and there was offices here. And I wouldn't necessarily think it's the greatest thing. I enjoy having a council chamber, but if we had to, we could meet in the elementary schools for council meetings. If it ever came to the fact that it was crucial to divide this room up and have the manager here or any other officials that we needed, at least temporarily, that is one solution. You might not want to go there, but I think the sentiment is out there. I said I voted for it, I believe in it, but I've had people approach me on their own about the town hall expansion. And I put my name behind it in a letter. I admit to voting for it, admit to voting for the budget, but the public does have their own opinion on that subject.
One last comment, if I may?
Yeah, I'll take one after you.
All
Go
right,
ahead.
all right. I just need to point out to the two individuals that contacted me with the same sentiment. I explained to them that the first time there was a warrant item, shall we move forward? I don't forget the wording exactly, but the voters in a warrant item approved the project for town, not expansion, consolidation project. The second year, they voted to put in more funding. The third year, we did it different. We said, shall we bond? We want to borrow instead of the saving method. And they said no. Now people can come up and say whatever they want, but there were 3 votes, and 2 of them, right from the beginning, and the very first one, which was important, told us to move forward. And we're moving forward. So.
Correct.
Oh, well.
Thank you, Sylvia. I was going to say that same thing, pretty much, but that's fine. Yeah.
Well, I'll move that we adopt the proposal that the town manager and the finance director have recommended.
Second.
Any further discussion?
I would ask, if I may, a question of Council Husband. What do you think of the input we've had tonight? I mean, I can go either way, but I do have concerns hearing from what I've heard from constituents.
Well, I'd like to ask a general question of the council. I'd like to find out from each councilor why they think the referendum, the budget referendum, was defeated. Why did we lose? And I've heard several opinions from the public on this, and this is what bothers me tonight.
We can certainly put that on a future agenda. What we've got on for tonight's agenda is consider and vote on adoption of alternative budget.
The alternative budget,
You're on right now.
Okay.
That's what we need to vote on. It's to reduce the current budget by $36,679.
Okay.
And we've got a motion, and it was seconded. We had further discussion. Any more further discussion relative to this particular budget item?
Could I just, Lisa, would you mind telling me what the motion was again?
It was a motion made by Councilor Thompson and seconded by Councilor Capalbo to adopt the proposal of the town manager and finance director. And that is...
No, I got it, Lisa. Let's just amend the motion.
You want me to amend it?
Because what you're trying to do is adopt the alternative budget with the
I'll,
recommendations.
you want me to just, okay, you want it, the amendment to be, to
adopt
the alternative budget
with the recommendation of the town manager and the finance.
That's fine.
Second.
Okay. All those in favor?
Of the amendment.
Of the amendment.
The amendment is to adopt the alternative budget as recommended
There's
by...
no more discussion.
Did you have any more comments, Scott, relative to this alternative budget item? We're not talking about financial referendum, we're just talking about, we have to adopt an alternative.
I'd like to ask them on their recommendation.
Ask who?
the town manager and the finance director, why they recommended that instead of
Well, I think,
some other area.
if I can speak for these two just briefly, it's not coming from operating, our operating side of the budget, which is good, okay? And the CIP seems to have the most money in it currently for us to tap into. And apparently, according to Bill, we're not going to possibly receive, by the time the RFPs go through for that street sweeper, maybe till next year on it, and it seemed a more likely place to take it. So,
I'll probably vote for it, but I really have reservations about it.
okay. Anyway. Motion was made, it was seconded on Sylvia's amended motion to adopt the alternative budget with the recommendation of the town manager and finance director. All those in favor?
Aye.
Aye. All those not in favor?
Nay.
Okay, David. 4 yeses, 1 no.
That was just for the amended.
Correct.
And then the motion as amended. Do it again.
Now we vote again?
Motion as amended? All those in favor?
Aye.
Aye. Not in favor?
No, I said aye.
Nay.
Okay. Again, 1 no, 4 yes. I need a motion to adopt the financial resolutions, all 5 of them.
So moved.
Second.
I'm not going to read them.
Any discussion? All those in favor?
Aye.
Aye. Next, under new business,
Did that include the tax resolution?
it included, it was all resolutions.
Yes,
All
all
resolutions.
They're listed together on the agenda as the financial resolutions.
Right.
Thank you.
And tax resolutions, yeah. Yeah, thank you. Next under new business is discuss and consider seeking reimbursement of expenses from the Charahoe School District for May 14th, 2013 and June 18th, 2013 Charahoe budget referendums. I had listed this because it was in our correspondence in a packet from Tracy Hay. Richmond decided to try and get reimbursed from Charahoe on the 2 budget elections that we had to incur the expenses. They're around $1,350 or so for each election, so we're looking for that reimbursement. So I just wanted to see if the council had any questions, concerns, or you think it's a good idea or not a good idea, and maybe we can send something over to our friends at Charahoe. So, Sylvia?
Georgia Year called me and asked me, make sure that Lisa, requests this reimbursement. And her insistence was because they discussed it at the school committee meeting, and that the school committee members, they said there is some money left in the account, because there are always monies left over in every account. And if we don't ask for it, it'll just all go to Richmond. So the bottom line is, the school has some money left. We should ask for it, and we will get some. We may not get it all, but we'll get some. And they will pay out to whatever towns ask. I just don't know if it'll be all of it, that's all.
Right.
So they recommended it. So
don't ask,
certainly we do too.
Dave next.
However,
He was
Yes.
there.
Yeah.
however, I was at the school committee meeting last week, and they addressed Richmond's letter. And I believe it was unanimous, I may be mistaken, but it was certainly a huge majority, voted against paying anything more to any one of the towns, but primarily they addressed Richmond's letter, to Richmond, than the $1,500 that was allocated initially.
Oh, well, I don't know what I'm hearing then.
Georgia
That's-
probably was the only nay vote.
Yep, she might have been the only nay vote. But that's...
So there wasn't any discussion about there's still money left over in the account?
I heard nothing about that. I heard them absolutely positively vote against giving Richmond any further money,
Period.
other than the $1,500 that was initially
Well, I'll
allocated.
tell you what, how about we send a letter over to them, and in the event that they change their mind and they decide to pay on this is the bill, and we would appreciate payment. If you decide to pay Richmond, please pay us too.
Well, it doesn't do
Does that-
it doesn't hurt
No, it doesn't hurt. I mean,
to ask.
Yeah, can I speak?
Hold on one second. It doesn't hurt to ask, so I think we hopefully will be all in agreement to send
Okay.
something over. If they pay it, great. If they don't, they don't. My first thing is, I'm sure they probably won't, but if we get lucky, great, you know.
All right, well, I'll talk to Georgia, I don't know.
So anyway, that's what that's Scott.
I think we should ask them for payment. The town of Hopkins spends about $18 million a year to the Charter School District. And in addition to that, the reason we've had multiple referendums is that you didn't listen. So by their own inaction or lack of leadership, financially this year, we've had multiple referendums on the Charter Hall budget. Thank you.
Thanks, Scott. Yes, Barbara.
And I want to agree with Councilor Hurst. That is exactly the case. The school board has not come up and done its own true due diligence. This was not our budget that we run for them. It is their budget. They have made us do it 3 times because they will not come to the table and address the citizens of Richmond, Hopkinton, and Charleston. We do this as a favor for their budget. It is not our budget, it is not our work, and we have no control over the fact that there's a second or a third if they have not dealt with the citizens of the town. I definitely agree, ask for the money.
All right, so I need a motion for us to send a bill
I make a motion that a bill...
to Carroll for the 2 votes that took place on May 14th and June 18th.
So moved.
Second.
All those in favor?
Amen.
Aye. Thank you. So Lisa, whenever you can do that, that'd be great.
When I have the final tally.
Rub it with a couple 4-leaf
Oh,
clovers.
yeah. Absolutely.
Next, under new
And inform them
business.
it's
Last
their
item under new
problem.
business
Their
is
fault.
Barbara. Discuss and consider authorizing the town solicitor and town manager to enter into a construction funding and maintenance agreement between Rhode Island Department of Transportation and the town of Hopkinton under the high-risk rural road systemic improvement project funded by the state of Rhode Island.
So moved.
I'll turn that over to our town manager, Mr. McGarry.
Thank you.
Can't just move.
During the first week of June, the town received a construction funding and maintenance agreement under the high-risk rural roads systematic improvement project from DOT. They have agreed to fund the design and construction of low-cost improvements such as warning and regulatory signage at unsignalized intersections and horizontal curves and pavement markings on state and municipal roads that are included in this project. The only hook for the town is that the town would have to agree to maintain these improvements at its own expense in the future. I've met several times with the DPW Director, Tim Teft, and we went over the program. The lining of the roadways involves edge lining and center line painting, and there are a number of regulatory and non-regulatory signs that will be posted at various intersections throughout the town, and they're enumerated in your package. Tim Teff forwarded to me copies of the specific locations where the signs are scheduled to be installed and the roadways upon which the lines are to be painted. And once I received the proposed agreement from DOT, I forwarded a copy of the agreement to Town Solicitor Pat Buckley. She reviewed and approved the document. And I asked him to have to come this evening, and if the council had any questions about the specifics of the program, he'd be here to answer them.
Tim, I had just one quick question. When is this all going to take place? Like pursuant to our town? I guess I know there seems like a lot of locations throughout the South County, but do they give you any timeline?
Okay, what they're trying to do is get it approved by the different municipalities, and there's going to be some state work done as well. Then it's got to go out to bid. And I asked them if they could give me any specific time when it's going to start, because Bill had asked. They said they'd like to get it done this year, but said some of the work could roll over till next year by the time they get everything done.
Okay. All right. Anyone have any questions for Tim?
And this was the book that they sent me that we're going to pick the stuff out of.
I saw some of that. Oh, my God.
So it's roadway painting and signage, essentially, right?
Yes, that's all it is. They're going to do for us.
And it's a tome. It's an absolute tome. It's a tome, the book.
Oh, yes.
I do have a question. Speaking of signage.
Yes.
Tim, the signage isn't going to include the street signs that we have to have, the street signs, is it?
No. They're going to be stop sign ahead. You're going to see a lot of curve ahead, stuff like that.
Okay.
That type of stuff.
Yeah, but not that new stuff.
Not the name stuff that we need to buy now. On stop signs.
Anybody have anything else for Tim?
By the way, at the end of Collins Road, on the Frontier side, there's stop signs gone. Just want to sneak that in. At the end of Collins Road,
Yeah.
on this side, the Frontier side, the sign's gone at that three-way intersection.
Okay, because
There's no stop sign.
I personally put that up last week.
Oh, okay, well then maybe I saw it just before
Because somebody
last
just
week.
said, I think it was Ree had called over and said
Oh,
it was...
okay, then you took care of it already. I couldn't even get a chance to tell you. Thank you. Wonderful. You're right on it.
That's why I was a little
Right on it.
surprised.
Wow.
Can I have a motion to authorize the town solicitor
What
and
a
town manager
public
to
works
enter?
we have.
Okay.
Well, Barbara
Second.
made the motion.
Second.
Oh, I'm sorry. All those in favor?
Aye.
Thank you. Bill, last public forum, anyone out there wishing to speak? Oh. Mr.
Just
Ted.
say one thing I wanted to bring up, the vote for the town referendum. My wife told me that she had heard a lot of people didn't realize what they were voting for, and to be honest, it wasn't that obvious what we were voting for. I don't get the paper. A lot of people don't get the paper anymore with the internet. I don't know if there's some way we could do a little better advertising, and then I don't know how,
I think
but
we learned a little
it just seemed to me that a lot of people, and I personally heard 4 or 5 people, thought that they were still voting for the school.
I had relatives that thought they were
So
voting
it
for the
just,
school.
I don't know if this might be something we want to think about next year.
Well, we
Okay.
had the one call now go out for the municipal. We also, I had an article in the Wesley Sun front page, but, yeah. it was on the
I don't know, but
website.
it's just
But yeah,
something.
no, I mean,
I think there's a little something we could do if this happens again. A little
to your
more.
point, Tim, when I was finished, Barbara and I were here at Town Hall for the vote, the polling folks said there were a lot of confused people here tonight. And I said, well, what are you talking about? She goes, a lot of people thought it was the town, the school budget. I said,
Yes.
really? I said, so I wonder how many folks voted that didn't ask what they were voting for.
They called me.
So anyway, your point's well taken. Thanks.
Thank you, Tim.
Yeah. So anyway, I need a motion to adjourn, please.
Mr. President, I move that the Hopkinton Town Council adjourn in memory of the following 3 deceased people: Matilda L. Baruti, known as Terry Baruti, Mary U. Jeffrey, and Mark G. Rhodes.
Okay.
Second.
All those in favor?
I
Aye.
don't think we do.
Thank you. That concludes our meeting.